What medications you use to help treat borderline personality disorder? That is an excellent question, and it is a great topic of discussion for psychiatry. So before we talk about how to treat it, let's talk about what it is. I found this chart in Carlat Psychiatry. I think this is a really beautiful chart. What I like about it is that it clusters the symptoms of borderline personality disorder into 4 categories. And borderline personality disorder has 9 highlighting criteria, and they're in these 4 clusters of symptoms. So it's unstable emotions, impulsive behaviors, inaccurate perceptions, unsteady relationships. To meet criteria according to the DSM for borderline personality disorder, you have to meet 5 out of the 9 symptoms of BPD. That is mood instability, inappropriate anger, feelings of emptiness, self-damaging acts, suicidal or non-suicidal self-harm, identity disturbance, transient paranoia or dissociation, abandonment issues, or interpersonal difficulty. Now, is there any medication out there that is FDA approved and directly used for borderline personality disorder? The answer is no. So, what is my role as a psychiatrist in borderline personality disorder? Well, I take a look at these clusters of symptoms, and if somebody is experiencing one of these clusters a bit heavier than others, there are some medications that might be useful. So for example, somebody with predominantly unstable emotions presenting in borderline personality disorder, they might benefit from a mood stabilizer, right? Like lamotrigine, lithium, Depakote, or even second-generation antipsychotics like Zyprexa, olanzapine, or Latuda, lorazepam. If somebody is exerting impulsive behaviors, self-damaging acts, maybe out of very low moods, or even out of kind of like an impulsivity, you can use things that are used for ADHD like guanfacine to help calm down the impulsivity. Or you can even use something like an SSRI like Lexapro, Prozac, Zoloft to help them get a bit better and more stable mood. Inaccurate perceptions, sometimes people with BPD can become transiently psychotic, and they might have a tenuous grasp on reality. And in those cases, you'd want to, make sure you do a lot of therapy, but also maybe address using an antipsychotic. As far as unsteady relationships, I think the best thing you could do as a psychiatrist or a therapist with a patient who has unsteady relationships is to maintain the boundary of the relationship that you have as a provider. Because the only way to heal unstable relationships is by modeling stable ones, even if those stable ones are not the ones that were broken in the past. I have a lot to say about BPD, but I hope this was useful.